Now, what is this ventilation perfusion ratio? So when we speak of the ventilation perfusion ratio, ventilation is alveolar ventilation, 4.2 liters per minute. And the perfusion is Q, that is the pulmonary blood flow, which is 5. So, simple MCQ. The normal ventilation perfusion ratio is 0.8. Okay, the normal ventilation perfusion ratio is 0.8. 0.8. Okay. And the ventilation perfusion ratio is more at the apex, that is 3.3, less at the base, that is 0.6. So you remember that the tubercle bacilli, they are strict aerobes and they prefer the apical lobe or the apical portion of the lobe of the lungs because they love oxygen, and ventilation perfusion is better over here now. Now let us understand this with more depth. Why this is so? See, I told you that the lungs are subjected to gravity. So because of that, this base of the lung has got more hydrostatic pressure. Okay, it has got more hydrostatic pressure, and this has got more negative intrapleural pressure. So there are intrapleural pressures and there are hydrostatic pressures, and all of them are affected by gravity. But remember that gravity is affecting hydrostatic pressures more than intrapleural pressures. Okay, gravity is affecting hydrostatic pressures more than the intrapleural pressures. ज़्यादा affect कर रहा है वो. So because of this concept, you can conclude that the lungs are better perfused at the base, and they are better ventilated at apex. So I repeat, the lungs are subjected to gravity. Both the intrapleural pressures and the hydrostatic pressures are affected by gravity. Hydrostatic pressures are affected more as compared to the intrapleural pressures. So we can conclude that the lungs are better perfused at the base and better ventilated at the apex, and the V by Q ratio is more at the lungs, apex, and less at the base. Now if I ask you, how will be the partial pressure of oxygen and partial pressure of carbon dioxide towards the apex and towards the base? So remember, towards the base, what you are getting blood is the pulmonary blood flow, which is coming from the pulmonary artery, which is deoxygenated. So here the oxygen will be 40 and carbon dioxide will be 45. Deoxygenate आता है ये question, simple physiology है, आपको समझना पड़ेगा ये, right? Apex में it is more close to the alveoli, better ventilated. So oxygen will be like 104 and almost 0 carbon dioxide. So towards the apex, the partial pressure of oxygen and alveoli will be like that of the alveolar air, but towards the base, they will be more like that of the pulmonary artery, which is venous blood. I hope this concept is crystal clear to you. I have taken all my efforts to let you know this. Now, so let us read something now. At 0.8, which is the normal ventilation perfusion ratio, oxygen is 104 and carbon dioxide is 40. ठीक है? If I say that the ventilation perfusion ratio is less than normal, always remember, less than normal. V by Q ratio less than normal. If it is less than normal, numerator is affected than denominator. Very simple. Numerator is affected and therefore only the ratio can go down. Ventilation is less, perfusion is okay. So, perfusion is okay. For example, any condition any kind of respiratory obstruction. You are given a clinical based question. A person is having a bronchospasm, he's having a bronchial tumor, he's having obstruction of the airways. What will be the oxygen and the carbon dioxide level? They will be same as that of the venous blood because there is no ventilation, right? So sufficient oxygen is not available to oxygenate, okay, because there is obstruction, the ratio is less. On the contrary, okay, here then the alveolar air will be equal to that of the carbon dioxide and oxygen as that of the venous blood, that is 40 and 45. Just now which I have told you. If I say that the ventilation perfusion ratio is more than normal, sometimes it is given infinity. Infinity ka matlab full numerator and no denominator. That means there is full ventilation in the alveoli, but the perfusion is not there, like pulmonary embolism. Pulmonary embolism, 0% of fusion. So oxygen and carbon dioxide will be same as that of the alveolar air, with oxygen 149, carbon dioxide 0, because of the alveolar air where there is no exchange of gases taking place, right? So this you have to understand, that ventilation perfusion ratio less than normal, no ventilation. More than normal, that is infinity with pulmonary embolism. And what would be the oxygen and the carbon dioxide partial pressures? So this, this ventilation perfusion graph is plotted with the partial pressure of oxygen on the x-axis and the partial pressure of carbon dioxide on the y-axis. Very, very important question, graph related question. So this is the normal point where the oxygen is 104 and carbon dioxide is 40. Okay? This is V by Q ratio infinity. Infinity means full ventilation and no perfusion. For example, pulmonary embolism. Graph related question with a clinical scenario, you should be able to mark the points. These points are hard and fast, right? Similarly, ventilation perfusion 0. No ventilation and perfusion is okay. So here the oxygen and carbon dioxide will be same as that of the venous blood, right? So this is again, graph is also important, right? Yes. Now, if you are given an MCQ, it is not printed properly, I'll just read up. A 43-year-old woman with history of asthma comes to an emergency department with an acute asthmatic attack after her bronchodilator inhaler ran out. Airway resistance is greatest when? At low lung volumes, at values lower than Reynolds number, during inspiration, with laminar blood flow, or in the total cross-sectional area of the smaller airways compared to that of the central airways. Remember that the resistance to airways is going to be least with higher lung volumes. Okay, the resistance to airways will be least as with higher lung volumes. So at low lung volumes, the resistance to airway is more. At high lung volumes, the resistance to airway is less. Similarly, pulmonary vascular resistance is least at FRC. A newborn with 28 weeks of gestation develops respiratory disease or a respiratory distress syndrome. Mechanical ventilation, 100% oxygen with 10 centimeter of water positive end expiratory pressure does not provide sufficient oxygenation. After surfactant is given through a fibrotic bronchoscope, the partial pressure of carbon dioxide, the fraction of the inspired oxygen, they improved. The improvements in the respiratory function is because of, now again the options are not given clearly, we'll try to read. It is because of the alveolar surface tension, bronchiolar smooth muscle tone, lung compliance, work of breathing, or the pressure gradient needed to inflate the alveoli. So it is very important, very clear, that when a newborn is born with respiratory distress syndrome and if you are giving a surfactant, you are going to improve the compliance of the lung because the surfactant is needed to decrease the surface tension. So the answer will be C, that you are increasing the compliance. Again, a 67-year-old man with a solid tumor that pushes against the airway, causes an obstruction to the airway, which point on this ventilation perfusion line of the O2-CO2 diagram corresponds to the alveolar gases. Now see over here. Just now we have considered this. This was ventilation perfusion ratio 0. That means this point is considered where there is pulmonary obstruction or there is no ventilation. So these points are hard and fast. They don't change. Okay, they don't change. They are fixed according to the fixed values of oxygen and carbon dioxide. So you can see definitely the answer is going to be A, point A. Ventilation reduced, perfusion maintained. Okay, now you have to calculate the alveolar ventilation. 40-year-old women, history of nasal polyp, aspirin sensitivity since childhood, comes to emergency department with status asthmaticus, requires immediate intubation, placed on ventilation with 40% fraction of inspired oxygen, control rate of 15 breaths per minute, tidal volume 500. What is the approximate alveolar ventilation? Now see, you are supposed to calculate the alveolar ventilation. This is the simple thing that is being asked, but beautifully scripted in the form of a typical INI-CET scenario-based question. But I am only interested in knowing that whether you are able to calculate your alveolar ventilation. So we know that the alveolar ventilation is dead space volume, the tidal volume minus the dead space volume into respiratory rate. So this is the dead space volume, which is equal to that of the weight of the person. The dead space volume is 1 ml per kg body weight, and therefore 125 pounds were given. So 125 will be the dead space of the person, right? Now, this is again an interesting topic of the types of diffusion. Basically, the type of diffusion you can also consider after you study the the transport of gases. But still, because the graph is here, we will complete it. There are different types of transfusion. One is called as the diffusion limited. Okay, it is called as the diffusion limited diffusion or perfusion limited diffusion. Okay. So when we are speaking of diffusion, we personally speak of the diffusion means the diffusing properties of the respiratory membrane. We consider two gases, carbon monoxide and nitrous oxide. Carbon monoxide is a gas. As soon as this gas will travel, it will come into the blood. It will be taken up by hemoglobin because the affinity is around 200 to 250 times more than that of oxygen. So to begin with, suppose the carbon monoxide gradient was 10 and here it was 0. Within a fraction of second, the gradient will become same and there will be continuous diffusion. Sorry, don't take this, 1 minute. After a fraction of time, initially the gradient was 10 and 0. So because of the diffusion gradient, the carbon monoxide will go. As it comes into the blood, all of it will be taken up by hemoglobin. That means in the plasma, you will never have free carbon monoxide. So this gas can go on moving from outside to inside, and always there will be a gradient which will be existing. There is no saturation because as soon as the carbon monoxide will come into the blood, it will be picked up by your hemoglobin. So that gradient will always be present. So the only barrier to diffusion will be the diffusing properties of the membrane. Diffusing properties of the membrane. That means if there is some problem in the diffusing property of the membrane, only then carbon monoxide cannot cross. Otherwise, continuously carbon monoxide can cross because it will never attain a same gradient. Every time it is coming inside, it will be picked up. So you can see here in the graph that 0.75 second is the time required for this transit of the RBCs through the pulmonary circulation. And you find that the carbon monoxide saturation does not come because it is always picked up. The reason that why it is diffusion limited is that it has got an affinity to bind to hemoglobin. If you compare nitrous oxide, which attains an equilibrium point in a duration of less than 0.2 second, nitrous oxide, if you consider, as soon as it comes into the blood, it has no affinity to bind with hemoglobin. So after some time, immediately, if the partial pressure was 10, it will here be 10. And no more nitrous oxide can now travel because both sides have become equal. Why equal? Because it is not taken up by hemoglobin. Now, if you want that more nitrous oxide should come, you have to move the blood ahead so that the old blood will go and the new blood will be. That means continuous increasing the perfusion or the blood flow. So when you increase that blood flow, only then the perfusion is increased, and therefore, only if you increase the movement of the blood or the flow of the blood, only then the diffusion will increase. So it is supposed to be a perfusion limited diffusion. That means it depends upon the blood flow. And oxygen is intermediate because oxygen is going to bind to hemoglobin, है ना? And also it is going to be present in the dissolved form. So if you get this graph, you must remember no equilibrium attained by carbon monoxide, intermediate is oxygen, and earliest equilibrium is obtained by nitrous oxide, right? So this is all for this session that was on our ventilation perfusion dead space. So study, solve related MCQs. Thank you.